Hi everyone. Today in this video let us discuss one of the medication Lurasidone. Lurasidone is one of the medication which is classified as antipsychotic. This is one of the second generation antipsychotic, or it is also called as atypical antipsychotic. These are the new generation antipsychotics with more effectiveness on relieving the symptoms of psychosis. So Lurasidone can be indicated for the treatment of schizophrenia. This is one of the common psychotic disorder that can be observed with different types of symptoms like hallucinations, where patient can perceive auditory hallucinations or visual hallucinations. They can perceive some strange voice or light without their physical presence. Similarly, delusions. These are the wrong perceptions or wrong judgments where one can perceive the things in a different way. These two symptoms are commonly called as positive symptoms of schizophrenia, where these symptoms can be treated by many of the antipsychotics. But still few of the symptoms are resistant to many of the antipsychotics and they are commonly known as negative symptoms, and among them social withdrawal is one of the negative symptoms. Similarly, flattening of emotional response, lack of any response in the people is also a negative symptom of schizophrenia, which is not relieved by many of the typical antipsychotics. But Lurasidone is a atypical antipsychotic, that is a second generation antipsychotic which can relieve both positive symptoms as well as negative symptoms of schizophrenia. So Lurasidone can be used for long term to reduce the symptoms of hallucinations, delusions, reducing the social withdrawal with less relapse of psychotic symptoms. So this is one of the main clinical indication of Lurasidone. Apart from this clinical indication, Lurasidone can also be used for the treatment of bipolar disorder. This is one of mood disorder where the mood of the people can swing from two phases. The people may have in the depressive phase. The depressive phase can be swing into the manic phase. So mood swings can be observed from depression to the mania as well as mania to depression. In such people, to control the manic phase, Lurasidone can be given, and it can also be given as an adjunct to therapy along with other drugs like lithium carbonate, which is an anti-manic agent. Similarly, valproate is another drug which can be used for bipolar depressive disorder. So Lurasidone can be combined with these drugs as an adjunct to therapy to control manic phase in bipolar depressive disorder. So these are the two clinical indications of Lurasidone. And this drug is available as tablet. Compared with other atypical antipsychotics, Lurasidone is having few of the advantages. This drug is available for long-term use with less risk of relapse of psychosis. And this drug causes less weight gain in the people, even it is having the low cardiac effects. All these are the advantages of Lurasidone compared with other atypical antipsychotics. So today in this video we are going to discuss how this Lurasidone acts, what are the important precautions, side effects, doses, all these things we will discuss in this video. First of all, it is the precautions of this medication. Just like many of the antipsychotics, Lurasidone can also increase the risk of orthostatic hypotension. So the people may have some dizziness, drowsiness, lightheadedness, and they may also have increase in the heart rate. They can have palpitations, awareness of heartbeat. So because of this orthostatic hypotension, while using Lurasidone, care should be taken while standing or changing the position. And this drowsiness may impair the attention in few of the people. So while driving the vehicles or working with machinery, care should be taken during the treatment with Lurasidone. Lurasidone can act by multiple mechanisms, so it can block one of the receptors, alpha-1 adrenergic receptors. These alpha-1 receptors are responsible for developing of blood pressure while you are standing or changing the position. So when these receptors are blocked, blood vessels are not getting sufficient pressure, so you may experience orthostatic hypotension. So during early days of therapy, dizziness and drowsiness may be produced by this medication. Second important precaution is in the elders. Generally in the elders, we can observe some loss of memory, dementia. This dementia may be associated with psychotic symptoms. So in the elders, there may be a coexistence of dementia along with psychosis. In such people, if we are giving the Lurasidone to control the psychosis, the psychotic symptoms can be relieved, but at the same time, lurasidone can produce few of the cerebrovascular side effects. So in such people, lurasidone should be carefully used because it can increase the risk of stroke, particularly in the elders who are having dementia related with psychosis. So in the elders, lurasidone should be carefully given. If you observe few of the symptoms like high-grade fever, rapid heartbeat, excessive sweating, difficulty breathing, along with some muscle pains, muscle rigidity, in such conditions, lurasidone should be carefully used because all these symptoms are collectively called as neuroleptic malignant syndrome. This is one type of syndrome commonly caused by many of the neuroleptics, that is antipsychotics. Even lurasidone is having the less risk for neuroleptic malignant syndrome and it is rarely producing these side effects. But if you observe many of these symptoms, it may indicate neuroleptic malignant syndrome, then care should be taken because this is a fatal condition which is particularly associated with high-grade fever along with severe muscle rigidity. Because of this muscle rigidity, it can reduce the breathing, which is fatal to the patient. Another important precaution of this medication is the involuntary movements. Even this is a rare condition, but on the long-term treatment, few of the people can observe involuntary movements. So some shakiness can be observed at the hands and feet. Even protrusion of tongue can be observed. Lip smacking, twisting of the tongue can also be observed in such people. If you observe any of these symptoms, it may indicate the development of tardive dyskinesia, a slowly developing disturbance in the kinetic movements, where care should be taken to avoid further development of tardive dyskinesia and the therapy may be stopped in order to avoid further involuntary movements. But this is a very rare condition that cannot be observed in all the people. Only during the long-term therapy we can observe any involuntary movements with use of lurasidone. Even this medication causes less metabolic changes, but with long-term use of lurasidone, we can observe a slight increase in the glucose levels. Sometimes we can also observe increased weight gain. But all these side effects produced by lurasidone are somewhat less compared with other atypical antipsychotics. And these symptoms may be observed after 4 weeks of treatment with lurasidone. Still, they are somewhat less compared with other atypical antipsychotics. Now let us see the side effects of this medication. With use of lurasidone, you can mainly observe somnolence, sleepiness in the people, rhinitis, cold-like symptoms, nausea. Some dizziness and drowsiness can be produced because of orthostatic hypotension. And even it can increase the salivary secretion, so hypersalivation can be observed. And even it can produce some restlessness and involuntary movements. All these are the common side effects produced by lurasidone. Now let us see how this drug acts. Lurasidone acts by multiple mechanisms. It can act on the different types of receptors. It can affect D2 receptors. It can affect 5-HT2A receptors as well as 5-HT7 receptors. All these receptors are antagonized by lurasidone. Apart from these, lurasidone can also block muscarinic receptors, alpha-1 receptors as well as histamine H1 receptors. But the antipsychotic and anti-manic actions are mainly related with blocking of D2 as well as 5-HT2A receptors. So within the CNS, dopamine can be stored in the dopaminergic neurons, and on the postsynaptic neuron, dopaminergic receptors like D2 are located. Now on the presynaptic neuron, calcium channels are expressed. When action potential reaches to the presynaptic neurons, calcium can enter into these neurons, resulting in exocytosis, which releases dopamine. Now this dopamine can act on dopamine D2 receptors, which are then activated. On activation, they can reduce the levels of cyclic AMP. The decrease in the cyclic AMP levels may result in hallucinations and delusions in the people. Now lurasidone can block these D2 receptors as a full antagonist, thereby it can relieve the symptoms of psychosis. Similarly, lurasidone can block the 5-HT2A receptors, which may be responsible for its anti-manic action. Now let us see the chemical nature of this medication. So this is the structure of lurasidone. We can see a large structure, but here we can observe one of the heterocyclic ring system. Let us give the numbering. This is 1, 2 and 3. So simply this is 1,2 benz isothiazole. So lurasidone is a benz isothiazole derivative. And here we can observe another ring system where a large ring system is attached to piperazine. So this is nothing but N-aryl piperazine. So lurasidone is a N-aryl piperazine derivative as well as benzoisothiazole derivative. How it is given? Lurasidone is available as a tablet at different strengths starting from 20 mg, 40 mg, 80 mg and 120 mg. The initial dose is started at 40 mg given once daily, and the dose may be slowly titrated such that the target dose may be variable from 40 mg to 160 mg per day. The total dose can be given as divided doses, but the starting dose is 40 mg given once daily. This dose adjustment can also be done based on the patient age as well as health conditions. In the people with any hepatic and renal impairment, the initial dose may be started at 20 mg given once daily. In this way, the dose of lurasidone can be customized based on the patient conditions. So that's all about this medication lurasidone, which is one of the second generation antipsychotic, or it is also called as atypical antipsychotic. This drug acts as a full antagonist at the D2 receptors, and it can be used for long-term therapy where it produces less relapse of psychosis. And this medication is having less cardiac effects and low risk of weight gain. With such advantages, lurasidone can be used to treat psychosis as well as it can also be used to control manic phase in the bipolar disorder. Orthostatic hypotension is one of the important precautions that should be considered. Rarely it can produce neuroleptic malignant syndrome, and on long-term use it can produce some involuntary movements. So that's all about this medication lurasidone. Hope this video is useful to you. If you really like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.